Asked for a referral to an infectious disease specialist. Got no comment. I asked for a prescription for 3 drugs that combat parasites: praziquantel, albendazole, ivermectin. She told me she would prescribe ivermectin. But first, she wanted me to take a blood test. I agreed to the blood test, asked for a parasite analysis in the blood work. I said, okay, you're going to have my blood. You got 3 vials of this stuff. You got a lot of my blood. Can you take one of these vials and do a analysis specifically for a parasite infection? And the only thing she told me was, it's expensive. So I got the results from this blood test back. It appears to be a pretty traditional blood test. White blood cell count was 11.4, bilirubin 0.21 milligrams slash DL. I came back and checked my blood results the next day. I took a picture of my MRI in with me that showed the infection. They told me, Celeste Richardson saw me, she told me my white blood cell count was high. I said, yeah, it's because, look at this infection. I showed her the picture. She said white blood cell count could be high from stress. It's not stress. Didn't want to see the picture. Asked if I had taken the medicine yet and why not. Why not? Because you want to do a blood test, right? You want to do a blood test before you prescribe me the medicine. That's what your excuse was. Now you're asking me why I didn't take the medicine before I got the results of my blood test. Very inconsistent. Ivermectin did something helpful. The area of the injury where there was biting burned for hours. Similar effect as Reese's pinworm. Around my body, somewhere, I assume it's coming from inside my body, I could smell, it smelled like death, rotting, or like maybe you've been outside walking around or something, you come up on a dead animal or a dead snake or something. That's what it smelled like. I could feel infestation diminishing. A week later, this drug was still working. Great drug developed in Japan. I believe my liver function improved. I was eating more and feeling energetic. Conditions improved. I was amazed. Bone damage still present. Wound is still fragile. Neck movement range limited. 2 weeks later, I feel better still. Now it's closer to 3 or 4 weeks later. Still feeling better, but I'm still feeling wiggling in my neck. And I'll try some other parasite drugs. Now, if you have an open or serious wound in your body, these things will be attracted to it, and they will latch on and grow and create a nest and proliferate. This is nothing exotic. It's like nothing. I don't think it is. I want to hope it's not. But given the circumstances of my situation, I'm forced to think in very creative and very unusual ways about this problem.